Hi everyone, and welcome back to MediFuture. My name is Kate Warnock, and I am the GuideWell Social Media Manager, coming to you live from the GuideWell Insight Lounge. I'm so happy today to have Steve Cashman, the CEO and founder of HealthSpot, here in the lounge with us. So welcome to the show.
Thanks for
Steve.
having me. Glad to be here.
We are so glad to have
event.
you, especially you were a big part of the GuideWell exhibit here on site, so I can't wait to hear more about that. I wanted to say though, with HealthSpot, Steve, what you've done is really take the idea of telemedicine and give it a very practical, consumer-facing application. How is it though that you can convince both providers and consumers to use this new technology in a way that they know they're going to get the most from it?
Well, like Oliver Wyman, we started this company as a research project to truly understand what it would take to create value for consumers and providers and payers and ultimately develop it. So as we go to market, we really look at a multi-stakeholder approach, right? At the end of the day, doctor wants to get his job done as efficiently as possible. A consumer wants to get to their appointment conveniently.
Right.
They want it solved. They want to understand what's wrong with them, get their prescription and get moving. At the end of the day, the payer wants to do that as cost effectively as possible, right? So we've really focused on a multi-stakeholder approach that is going to solve that, meaning that all the different parties that touch a consumer are giving them the same message. Here's where to go, you can see anybody, the doctors are on the other end, and it's convenient for you at your neighborhood pharmacy.
So I guess convenience is really, that's a critical message that we heard earlier from Andrew Rosenthal with Jawbone, and said that really in order to impact behavior, you have to make it as convenient as possible, and clearly that's exactly what HealthSpot has done. So, you know, I was wondering, as healthcare innovation continues to innovate, something like HealthSpot was done in a very, you started out as a research project. It was done in a very methodical way. Not everyone necessarily has that same careful consideration of the consumer. So as we continue to innovate, how do we make sure that quality of the medical care that's delivered is not perhaps overshadowed by a convenience factor or other measures that are typically in place for a traditional care delivery system?
Yeah, it's a challenge, and I think it's a big challenge because of where medical's at today compared to other industries, right? So I think it's important when you work through developing a new product or service. The easy thing's understanding the value, and I mean when I say value, the financial benefit to the system, right? Whether we're moving healthcare into a pharmacy from a high overhead hospital, or whether we're maybe moving labs from a hospital or a lab environment out to the edge of the network with the consumer. You really got to take and build groups of multifaceted folks to do that. So my background's consumer is electronics. It's not healthcare, right? So I'm looking at the type of people that put a product on a shelf in a Best Buy, in a Verizon store, and it either flies or it sits, right? So you got to have people looking at things from that perspective, but you also got to bring the clinicians in to really look at the validity, and that was one of our key learnings when we started the company. Is telemedicine's been around for a long time. There's 200 plus companies with iPad apps out there.
Right.
Why isn't anybody using them? Why isn't anybody reimbursing for them, right? So to really get a payer, get a doctor, some clinicians, and get some consumer focus groups going, and truly start to build a research project to understand, is this solvable or not, right? And I think, and then ultimately, even if it's solvable technologically, which typically isn't the problem in healthcare, how do you bring it to market in a manner that the consumer is going to quickly adopt? And the only way to do that is to try a little bit of it and keep working through it and iterating. I think one of the challenges healthcare has is that we're constantly looking for the silver bullet. And the reality is true innovation happens by trying it, studying it, refining it, trying it a little bit more, and pushing it till you perfect it, right? Some people like Apple do a really good job of doing that inside the four walls, but when you look at healthcare, you got to do it out where it touches people. Right,
and it really is, I think if we've heard nothing, the most recurring theme here at MediFuture is the consumer belongs at the center of that care delivery ecosystem. So, obviously with HealthSpot, that's obviously your end goal was, how do we best serve the consumer? I'm wondering, what else have you heard here at MediFuture that have been, some takeaways that you'll leave here with?
Well, I think this event is key for us because one of the challenges that healthcare faces is you look at all the hundreds of health systems and tens of thousands of providers across the country, and literally the dozens of providers or payers in each state, is how do you take innovation and get it in front of them to where they can truly get it into their strategy and thought process. And what you see, a lot of innovation comes out of smaller companies, right? So typically the big companies operate, the little companies innovate. And so what you got to have an ability to do, and what this conference is doing a phenomenal job compared to a lot of the other venues that are out there every year, is we're getting the senior folks in here that are formulating the 5-year strategy for their health system, for their payer plan. They're understanding the dynamics and decisions they're having to do with the exchange and new patients in the system. So, I mean, creating a venue like this where they can come and touch and feel the product with other stakeholders, share ideas, get the latest research, is truly revolutionary to this space, because the majority of the trade shows that are out there and other events are very specific, but you're not getting the decision makers or the strategy guys to the table. So congrats to the folks putting this thing together, because we've sat in front of hospital CEOs and CFOs, we've sat in front of payers and their CEOs and CFOs, and just really are able to articulate alongside the retailers what we're trying to do here and make that tangible.
And I really think that was the goal of the Oliver Wyman Health Innovation Center with MediFuture, was to bring the people who needed to collaborate to a single place where they could easily do so and create perhaps new partnerships. So I'm glad that that's been your experience today. So I can't thank you enough for being part of our Insights Lounge here for GuideWell, and look forward to seeing you again in the future. This is Kate Warnock with GuideWell. I look forward to seeing you again soon.